Hello, this is Raul with Chilled Nurse. Gonna be going over some top posts on r/nursing here on Reddit, and we got some good ones today. First, we have what is something you can't ever see the same since working as a nurse? I'll go first. By the way, no hate to these people. I can't really stand long nails. I have seen so many patients with so much yuck under the nails. I just get nauseous when I see long nails. I agree, especially if they're like this long. You just imagine, like, how do you wipe? Hello. Anyway, for me, it's stage 4 tunneled wounds. In nursing school, you don't really experience these. First time I saw one, stage 4 tunneled, I'm like, this can't be too bad. Took out the Mepilex. I'm like, ooh, yikes. I'm taking out the iodoform strips. I'm like, huh? How does this happen? That kind of scarred me. I'm used to it now, obviously, but I'll never see them the same, you know? Next time I see someone say, oh my god, look at this wound, and it's like a little abrasion or something, I'm just like, well, have you seen a stage 4 ulcer with some tunneling? Because let me tell you, or some Charcot foot. Yikes. After working in a hospital, what are some things you will never do or try? I'll go first. Smoke, ride a horse, stick things up your bum, eat slugs, do meth, leave my high blood pressure untreated. I wonder what happened with the horse that he will never do or try. Drugs, for sure, never. Meth, heroin, cocaine, yeah, everything, all that stuff. Get it out of here. Smoking also, I want these lungs to be virgin forever. Okay, I've seen way too many crazy patients on drugs and lung diseases and no, I'm done. Get it out of here. Sticking thumbs up your butt. On the bed, yes, that's fine. But any other time, stop. New high score, 7,735. Send this person to the cath lab immediately. Am I the only one who likes med-surg? To be honest, med-surg feels like... Oh, wait, before I read this, yes. No one likes it. To be honest, med-surg feels like a sitcom to me. I pull up, guaranteed 2 or 3 patients are up to no good in a mildly entertaining way. Room 12 is throwing his toenails at people with his gangrenous foot. Ugh. Room 19 is trying to sneak off the unit to have a quickie with her husband. My hospital recently had someone who left the hospital and then like the security was all over him downstairs. Everyone was looking outside the windows like, oh my god, what the heck? Kind of crazy. Room 15 is popping her own Percocet between pain meds and hitting her cotton candy vape. Alright, where is security? Hello? Why? How is she able to have a vape and a Percocet on her? You know, especially on the floor, because this guy says med-surg, or this woman, I don't know. Well, they're deleted, so who knows? Yeah, usually security or you are supposed to take things away like that. It's just contraband stuff. Come on now. Room 17 is pleasantly confused, asking me why I'm a nurse if I'm a man. I've never gotten that, but I could see it. Some people get... Actually, yes. I went to a room once, and because I'm a male, they're like, hey, doctor. It's like, I'm a nurse, but thank you. What does nursing school not prepare you for the real world? Basically everything. In nursing school, you get the basics, the foundations, the core. That's it. They don't teach you how to communicate with doctors. They don't teach you what to do. Well, I guess they teach you how to do code. But there's nothing like experiencing a code. So basically everything. You have to really experience everything in the real world to grasp it. Nursing school only does so much. I fear my reign is over as the Urethra whisperer. I've missed 2 straight cats in the last 2 weeks. Other nurses missed them too, to the point where the resident had to be sent to the hospital to have it done? Yo! What? Okay, what kind of absolute anatomical monstrosities are you guys dealing with here? My worst fear is having to urgently poop during a code or a rapid. That's all. That's the post. Same. Why are my patients always naked? That's 2 in 1 week. Last one was a confused 100-year-old lady. Okay, that's par for the course. This time it's an alert and oriented 35-year-old man. Dude, why the crap are you naked? This is a hospital. The 100-year-old lady, I get it. You know, they're confused. Whatever. That 35-year-old alert and oriented, that's kind of weird. Maybe he's a CWA, but you guys didn't really know, and now he's withdrawn like crazy. I've had this all the time. It's those confused patients, dementia, sundown, CWA. You know, you do your hourly rounds. Hello? butt naked. It's like, oh, dude, come on, you know, get the gown back on. You leave. 5 minutes later, oh, butt naked again. It's like, what's going on, dude? But yeah, this is par for the course when you're a floor nurse. It happens. Ugh, a needle stick. Has anyone experienced a needle stick before? I work in the ICU. I'm a new grad. I had a combative patient that I moved, and I was putting the safety on the sub-Q needle when they moved and then pricked my index finger. Patient has a history of HIV. Okay, damn, that's not good. I went to the ED, did labs, filed for workers' comp, and even did an ERS. Doctors told me that there's less. Okay. So, it started the prophylaxis treatment too. That's great. Even though it is less than 1% chance, it's still good that you get that treatment. I heard it's awful. It just throws your body out of whack. But it's good because history of HIV, you don't want to mess with that. I had a needle stick too. It just happened last month. I've been a nurse for about 2 years. Pretty freaking embarrassing. I was, turning red and everything. But I went down to the ED. They treated me, or they looked at me. My patients that they tested were negative for everything, so thank God. It's very embarrassing, but most, I'm not going to say most, but a lot of nurses go through it. I mean, you're dealing with patients that are confused, combative, all that stuff. It's bound to happen. Don't be embarrassed. It happens. Practicing IVs on coworkers. Some of our new grads have no experience, so we let them practice on us with our direction. Have you ever done this at work where you work? Yeah. I did it in my last hospital. We did it at this hospital. Yeah, I think it's pretty common because these dummy arms, they're not the same as real humans. So as long as you have someone on the floor like me, you can't really see. But if you have a vascular person, very easy for them to practice on you. I like to help new grads as much as I can. Yeah, it's pretty common. And to end off, you're too generous. Charge nurse be like, you get a patient, you get a patient, everyone gets a patient. Freaking hate admissions. So that's the video. Hopefully you enjoyed. Gonna be doing this hopefully weekly. I'm gonna be also reacting to some nursing memes and some nursing TikTok videos, which are pretty cringe, and we'll talk about those later. But hopefully you enjoyed. Please like, comment, subscribe. Peace.